Hello, Thrive Nation. I've got a very unique doctor. He's a medical doctor. He's board certified as a family physician. He's into functional medicine, uses acupuncture, uses kinesiology, nutritional therapies. He's a teacher of teachers. He is a doctor, the docere meaning teacher. He's got 16 books that you can get online. We'll put the link in the show notes. I'm a huge fan of his work. Due to this man and two other doctors that we've had on the show, Dr. Frank Schellenberger and Dr. Thomas Levy, I've dispensed hundreds of bags of hydrogen peroxide to be nebulized by clients and patients all over South Africa, Africa, and even Europe. So I'm truly grateful to have Dr. David Brownstein on the show today. So welcome.
Oh, I'm happy to be here. Thank you for having me.
Good. I want to jump straight in. I want to get the attentions of the audience or the viewers who are going to be watching this on YouTube. In my other life as a physician over 23 years, I have not seen something work so well as nebulized hydrogen peroxide. I do want to get the ins and outs of how you add iodine, because that's not something that I've used until I wanted to speak to you about it and get the exact details of the concentration and what you do. But I've listened to a lot of podcasts that you've been on. Now, Dr. Brownstein, why is nebulized hydrogen peroxide so effective?
You know, Steve, I would agree with you 100%. I've never seen anything work as well as hydrogen peroxide for flu and flu-like illnesses. So, can you ask me your question again?
Why is hydrogen peroxide so effective?
You know, hydrogen peroxide is produced all over the body. The white blood cells produce it to fight foreign invaders. Every cell in the body is bathed in hydrogen peroxide continually. It's accelerated production when there's stress and foreign, illness going on in the body, and that's the body's way to combat that illness. So, we were designed appropriately to be able to withstand viral illnesses and bacterial illnesses. Otherwise, we wouldn't be around as a species. And, one of the major mechanisms we were designed to combat that is to produce hydrogen peroxide. And, what I found well over 2 decades of utilizing nebulized peroxide. Now we use peroxide IV as well in our office, intravenously. But what I found with, nebulized peroxide over 2 decades is, it's remarkably effective at helping people suffering from any lung issues, pneumonia, colds, coughing, COPD, chronic obstructive pulmonary disease, lung cancer. Look, I never claimed peroxide or any of my therapies was a cure for keeping people not getting sick, because my patients get sick like everybody else is out there. But it's a wonderful treatment when they're sick, and it's a way to support the body's immune system, and it's a way to enhance the immune response to a viral illness. And there's virtually no side effects with the doses that I'm using. The only side effects I see are that it doesn't help some people, but I never see adverse effects from doing this therapy.
Tell me where it started from. I'm not sure the origin of nebulized hydrogen peroxide. When I started looking into this, I thought, gee, it doesn't sound good. A lot of my patients, clients, and medical professionals are saying, how can you nebulize this? It's going into the lungs. It's an oxidative type of or oxidant type of therapy. What's actually going on, and where did it start?
So, look, the use of peroxide in intravenous peroxide dates back almost 100 years. And I believe that the first report was out of an English physician who was in India during during a war. And this was before the advent of antibiotics in the 1940s. And when soldiers got pneumonia, at that time, there was an 80% mortality rate. So I wrote about this in my Ozone book. The physician who, I can't recall his name right now, but the physician who decided to try peroxide tried it because he knew peroxide stimulated the immune system. He knew peroxide had some antiviral and antibacterial properties to it. And he knew peroxide, when it breaks down in the body, would break down into water and oxygen and help to oxygenate the tissue. Recall the chemical formula for hydrogen peroxide is H2O2. And 2 molecules of H2O2 break down into water and oxygen. So he gave a group, he randomized a group of soldiers to receive peroxide or, the usual care, which was before antibiotics, which was probably nothing. And the death rate from pneumonia went down about 50%. And that was the first, now he was treating these very sick soldiers with peroxide. He didn't report any side effects with it. So that was one of the first reports that I read about it, and I became intrigued with it. And I didn't really think about nebulizing peroxide, but I wanted to do intravenous peroxide. So I went to a course, and the course was taught by Charlie Farr. It's an old name for those of us that are, middle-aged and up. And he was one of the founders of oxidative therapies. And, I was worried about, just like your colleagues, I was worried about dripping peroxide into veins and to have people possibly nebulize peroxide. It's an oxidative therapy. We're taught oxidative therapies are dangerous, and, they're going to break down tissue and cause inflammation. And, I went to this course, and, there was copious amounts of information showing that when it's used appropriately, it's safe and it's an effective therapy, particularly during infectious times. And my first round with peroxide was using it intravenously. And, I decided that I was worried about the one side effect of peroxide intravenously that's reported continually is that it irritates the veins, and the veins go away because they get inflamed. So you can, if you're poking somebody for it, they can lose their veins, which creates other problems.
Yeah.
So I just cut the dose way down. I figured I would try half the concentration of what I was taught. So I went to this 0.03% concentration intravenously, and our patients' veins weren't going away. Nobody was irritated. I've got over 25 years of experience. We do not see veins going away from hydrogen peroxide use in our practice. And, there were a couple of old articles about, inhaling peroxide, inhaling nebulized peroxide, and there were case histories with it. And I figured I'd try it. And so I was the first test case. I have a history of severe asthma, and I always get asthma attacks. I used to get asthma attacks a lot, and a lot of ER visits, and I was on inhalers and all the medications and things. And when I cleaned up my diet, and particularly removed the things I was sensitive to, like dairy, and just got sugar out of my diet, I don't even have an inhaler anymore. I used to carry them around with me. I don't even know where they are anymore. But the only time that I get some symptoms of wheezing now is if I get a cold. So back then, 25 years ago, I got a cold. I was starting to wheeze and figured I'll try nebulized peroxide. And I tried our formula, and wheezing went away immediately. And
Wow.
I started using it on patients. And what we found with using a holistic treatment to support people who get sick during flu season is our patients don't get sick. They get sick. Our patients don't get very, severely sick. They don't get hospitalized, and they don't die at anywhere near the rates that are reported. My partners and I talk about this all the time. In the US, from 20 to 100,000 people die every year in the flu season from flu or flu-like illnesses. So we've got 100 years of practice between the three partners. Now we have 6 practitioners, but between us, all older guys, between 100 years, we should have 100 years times 60,000 people dying a year. That's a lot of people dying. We don't see that in our practice. None of us can recall anyone dying from flu and flu-like illness. None of us can recall hospitalizing a patient for flu. And so we just started using it, and it's a truly remarkable therapy, just like you said. And so, I was doing the nebulized peroxide therapy, and so nebulized means to put it into a mist. So you put liquid dilute solution of hydrogen peroxide and saline in a nebulizer, and it blows air through it and becomes misty, and then you can inhale it into your lungs. Well, a few years later, I learned about iodine, and I started researching and using iodine in my practice and seeing wonderful results with that. And as in my research of the old literature on iodine, there was a bunch of articles about nebulizing iodine for pneumonia and flu-like illnesses and lung problems. The lungs have a huge amount of iodine at saturation that they should have in them. And iodine has antiviral properties to it. It has antibacterial properties. There's no virus, bacteria, parasite, fungus that's been shown to be resistant to iodine. It's the reason in surgeries, they'll still use iodine to scrub the skin down to sterilize the skin before opening it up. And so I saw the old literature about iodine. So I started having patients nebulize iodine, a dilute solution of iodine. They got better with flu and flu-like illnesses, very similar to peroxide. Then I decided to combine them, and it just worked. You know, there was a synergistic effect. So that's how it all came to be. And, you know, we've got thousands of patients we've done this with. And just as you said, for coronavirus, you know, I asked the patients, because I put them on we'll get into the whole regimen, I'm sure, but, you know, it's an oral regimen of vitamins and ozone and peroxide. When I ask them, when they get better, like, what do you think, you know, you got better from, or can you tell? Because we're doing a few therapies at once in some of them. Routinely, they will say when they nebulize that peroxide, their pulse ox went up. If they checked it before and after, pulse ox maybe in the 80s, goes up into the 90s. They could breathe better. They could cough up stuff better. They just felt better from the peroxide, you know, nebulizing that peroxide iodine mixture. And that was reported to us, and it's still being reported to us because we're still in the middle of, you know, a mess here, you know, with COVID-19.
Right. Now, tell me about the research, the data, because I mean, obviously there's some concerns from a medical liability point of view, going back to the research from nebulized hydrogen peroxide. Is there significant research on nebulized hydrogen peroxide or nebulized iodide?
There is not. There's not randomized placebo-controlled trials. That's sort of the rub with things. And I guess if we want to be robotic and we want to not think, and we want to just do, you know, and we just can only treat with randomized controlled trials, then probably 80% of conventional medicine would go away, because about 80% has not been randomized controlled trial studied, yet we still do it. So there's a lot of case histories back in the early 20th century from using iodine and nebulized iodine and IV peroxide, certainly written about a lot more than nebulized peroxide. There's not a lot written about it. So when I published my peer-reviewed article on treating coronavirus, you know, I did a literature search. I couldn't find much on nebulized peroxide that's been peer-reviewed and written about. But I can tell you, after 30 years of experience with it, you know, I don't really need a randomized placebo-controlled trial to tell you that it works, because I see the results in my practice every day. So that is one of the rubs with it. But, you know, as I would tell my colleagues, what were you going to do when coronavirus started? What are we supposed to do? What we did in our country was we told patients to stay home till you can't breathe, and then go to the emergency room. Back in the early part of the crisis, that was it. There was no therapy offered to them. And, you know, when they went to the emergency room a year and a half ago, you know, if they got ventilated, 88% were dead from being ventilated. And I have said from the beginning of this crisis that we need to support people's immune systems. We need to give them therapies that make them, you know, allow them to breathe better, allow them to support their immune system. And I think nebulized peroxide is one of the key therapies for that.
Fantastic. Tell us a little bit about concentration. Obviously, Dr. Thomas Levy, who I highly respect, and his work in terms of the oral microbiome and looking at cavitations and root canals and their link to cardiovascular disease and cancer. His book, The Hidden Epidemic, I think was a revolutionary book for myself as a functional medicine practitioner in my, you know, my other life, having a look at, you know, the mouth and the health of the mouth. About concentrations of hydrogen peroxide, also had Dr. Frank Schellenberger on. He, you know, I first heard about it because I'm part of the American Association of ozone therapy in terms of his protocol. What is your concentration on hydrogen peroxide and then on the iodide?
So I've been recommending for 25 years a 0.03% solution of hydrogen peroxide mixed in sterile normal saline. And it's a very dilute solution. I think that's why we don't get adverse effects with it. If you use a higher concentration, it does dry the throat out a little bit, maybe give a little bit of a sore throat. But, you know, I did have a few patients who were out of state and got sick with COVID, you know, at the beginning of the crisis, and they didn't have any, you know, they didn't have the solution that we mix up. And they, you know, they were, you know, my cousin was one. If you were watching my videos of my interviews with my patients before the federal government shut me down, I had my cousin on there, Jeremiah, who was a chiropractor in the state next to me. He was 4 hours away by car. And, you know, him and his wife called me up, and he can't breathe. And he's got COVID, you know, he's got all the symptoms and fever and all that, but literally says he walks up or down two stairs. He's sitting on the stairs before he can walk a couple more to get up or down the stairs. And, what do we do? And he's scared and he doesn't want to go to the hospital. At that point, that was that time when, you got ventilated, you were 88% chance you were dying from it. So, I said, do you have a nebulizer? Because his big problem was breathing. And he said he was reading my stuff and he got one from a neighbor, but he doesn't have the peroxide. So I said to his wife, we need to get food grade peroxide. We need to get some sterile saline, get that at local pharmacies or drugstores, apothecaries, whatever term you use for them. And you can buy them, over the counter. And he had the iodine in hand. And I said, look, we can nebulize iodine when that's sterile saline, we just have to dilute it a little bit and we can nebulize peroxide. So he was in a bad state. I was videoing him and they had the 3% peroxide at home. So she didn't want to leave him at that point because he was just too critical. So in a pinch, I said to him, all right, we can try this peroxide, but if you're not better, you gotta get to the hospital right away. And he wasn't saturating that badly. It was about 85%. It's not good, but it's not, I didn't think he was going to die from this. So in a pinch, we used the 3% right out of the brown bottle, which is not a sterile form of, not a clean form of peroxide. And he did complain that it was irritating to his throat and gave him a sore throat, but he finished that and his pulse ox went up from 85 to 90%. Felt better. She could leave the home at that point, and then she went and got food grade peroxide and saline, and we just did the dilution and diluted it down to 0.03%, and put a drop of 5% Lugol solution in there, which is 6.25 milligrams in that well. And then he began nebulizing every hour, and he got better. But that's so I know Dr. Levy uses a higher concentration of peroxide. I can tell you after 25 years of doing it, it's not needed. It's just not needed. Ours has worked fine. I don't see any clinical difference in using the higher percent, except they get sore throats with it. And I haven't used it enough. He was really one of two people in the middle of this crisis that we were just in a pinch. It was either do this peroxide or going to the emergency room. Let's try and keep you out of the emergency room. And it worked on both cases. But I don't have a big load of patients to tell you that higher concentrations are fine, safe, and all that.
Yeah. Tell us a little bit about the microbiome, the nasal microbiome, the oral microbiome. I did speak to Dr. Frank Schellenberger about, ozone rectal insufflation. How does it affect the microbiome in the gut and in the colon? There's a lot of research in the microbiome and how exactly, something like nebulized hydrogen peroxide, what it does to, obviously your microbiome in your nose is very important and your mouth is very important. How does it affect that, or what does it do to the good bacteria? Does it help them proliferate and deal with sort of your anaerobic bacteria? Give us your opinion on that.
Well, the microbiome is huge. That certainly outnumbers us, our own natural cells, by multiple folds. We're full of bacteria, full of viruses, and I guess we're full of a lot of crap, right? But one of the criticisms about using iodine or peroxide or ozone, well, what if it kills our own beneficial bacteria, our own biome? That's just not the case. We know peroxide and iodine especially. These are essential items. We can't live without either of them. Either we get iodine in our diet, or we supplement with it, or we don't live, since every cell needs and requires iodine. And I've written about that extensively in my iodine book. And as far as peroxide goes, as I mentioned at the beginning of this, every cell constantly is bathed in peroxide and produces peroxide, and there's more of it produced when we're sick. If this stuff was killing our own cells, we wouldn't even be here, and that's just not the case. I do not see the use of iodine, peroxide, or ozone damaging, disrupting, or negatively impacting our own microbiome anywhere in the body. That includes the nose, the mouth, the mucosal lining of the back of the throat and the esophagus, and as well as the gut.
Fantastic.
I think that's clear. That's that if that was the case, then I don't know how we'd be here as a species.
Good. I've started using a water flosser and not using traditional flossing, putting hydrogen peroxide and, to cleaning my teeth. If I've got a bit of a scratchy throat, I've seen a lot of patients here, that are very sick. I use this water flosser at the back of my throat. What do you think about, flossing with a water flosser instead of traditional flosser and using hydrogen peroxide in the mouth?
Well, I haven't thought about that. As you're saying that, I think that's a great idea. And you know what? I'll give you credit for it. I'm gonna borrow that idea and start asking my patients to do it. And I'm gonna try it. I've had people floss and I mean a water pick with iodine, a drop or two of iodine in the well of a water pick. The only negative to that is if they have porous teeth, which a small percent of people do, it'll stain the teeth a little bit brownish color. And it'll just continue to stain a brownish if you continue using the iodine. Once you stop it, it'll go away over time. But those people with porous teeth can't do that. Peroxide won't do that. I think that's a great idea. I could see benefit in it. I can't see harm with it. And I think. What, how are you putting the peroxide in the water pick? Are you measuring it out, or are you just putting a little bit in?
Yeah, I'm just putting a little bit in the bathroom, obviously 3% food grade, and just mixing it up, a small dosage, and it's just seemed to clean my teeth. I've got less tartar buildup, I've got less plaque. In terms of any halitosis or any sort of bad breath, it's dealt with that. My teeth just feel better, and I don't need to spend the time brushing. And I've always thought, and I got this from Dr. Levy, is that if you want to clean something off a surface, using water is much better than trying to use a hard substance. Where if you're not focused with floss, you can cause a lot of sort of damage to the gums and cause any sort of openings in the teeth and get bacteria in there. So I'm a big believer in using that, but I wanted to get your thoughts.
I think it's a great idea. Let's talk again about that. I think there could be a paper out of that one. That's a good one.
Great. So talk about a little bit of ozone. You've got a book. We use a lot of rectal insufflation. I know you were doing that in the parking lot to treat COVID patients. You were calling them butt shots. I've seen it work incredibly well. The difference between hydrogen peroxide IV, the difference between major order hemotherapy, your experience. What I love about you is being in practice so long. I think of the story of you, 1992, getting a vitamin D test from labs. No one was doing it. You started. You've just got a lot of research, empirical evidence. So that's why I wanted to get you on the show, because I think combining the research, the science, and just years and years and years of empirical evidence is so powerful. So give us your view on traditional ozone therapies and something like an IV hydrogen peroxide and the benefits of each.
Let's take peroxide first, since we've been talking about peroxide. So as I mentioned, how I got started in peroxide, Charlie Farr's course, and once I read the research, I was comfortable doing it, and we started doing it. And it was interesting talking to conventional colleagues about dripping dilute peroxide into the veins. Everyone's like, "How can you do that? You're gonna kill all these people." Not only did you not kill people, you helped people. Their veins didn't go away. We've been doing IV therapy in our office for close to 30 years now. I mean, tens, probably hundreds of thousands of IVs now at this point. And we do a whole combination of different IVs, from vitamin C to glutathione to minerals, whatever. I mean, a whole bunch of different ones. Probably have 30, 40 different IVs we do, depending on the patient's needs and their disease state or their health state. So we have a big IV practice. My nurses are busy. Our office is busy, and every once in a while I'll query my nurses and say, "Hey, what are you guys hearing about what's the best IV patients are reporting back on? What do they feel best on?" And routine. This has been for close to 3 decades. Hydrogen peroxide IVs they get more positive reports on that one than the other ones. Now we get positive reports on all the IVs, but the hydrogen peroxide IV, when it's done appropriately, is a really cool thing. And in my book on ozone, and even in my COVID book, my viral book, it's not about COVID, it's about viruses, holistic approach to viruses, but I wrote it during the middle of the COVID mess. What I describe with the use of these oxidative therapies like ozone and peroxide is that the media and doctors and the powers that be have all convinced us that antioxidants are good for us, that we need antioxidants. And oxidants which most people aren't really aware of that word, but the opposite of antioxidants would be an oxidant, are bad for us. Now, an antioxidant can be something like vitamin C, can be vitamin E. What these terms refer to is, are they electron donors or are they electron receivers? We don't really have to get into that, but I call this the teeter-totter, and I did a teeter-totter I had a picture of a teeter-totter in my book on ozone, and I put that same teeter-totter in my viral book. And I always say that to get the positive effects in the body and to get health, you need a balance of everything. You don't need too much of one thing. We can get too much water. You can give someone too much oxygen. That's going to damage the lungs. People die, in the US every year from drinking too much water. They become hyponatremic. They lower their sodium down enough. They can go into cardiac arrhythmia or have a bad seizure, and they'll die from that. So you need a balance in things. And that goes with oxidants and antioxidants. So the analogy I would use for the listeners is every 8 to 10 years, if everything's going correctly in the body, you get a new skeleton. Your body's breaking down old and injured bone and building new bone up. And if everything's working correctly, about every 8 years or so, you got a whole new skeleton from what you had 8 years previously to that. Now, the way this thing works is you have oxidants like peroxide, like ozone, and even vitamin C at high doses can be considered an oxidant therapy. But the body produces other oxidants to fight infections and to break down old and injured cells. That's how we get rid of things that don't belong in our body. So you need oxidants to get rid of the old, and you need antioxidants to start the production for the new to come into play. So you need this balance in the teeter-totter. And these oxidants and antioxidants, one can donate an electron, one takes an electron. The antioxidants donate an electron, the oxidants take an electron. And the reason this is happening, this donation of and receiving of electrons, is this movement of electrons stimulates energy production, stimulates ATP formation in the body, in the mitochondria. And that's how this whole system works. We were designed for this to happen. And so I see some patients who, they feel lousy, they're achy, their brain's not working, and they come in with 2 grocery bags of supplements, and they're heavy, they're full of stuff, and they're full of all good stuff. I mean, we take them out, we lay them on the table, and there's 4 rows, of a 5-foot table, 4 rows taken up with antioxidants, basically, vitamins. And, there's nothing on, I would tell the patients, there's nothing on here that's really bad for you, but I think you're taking too much. You have antioxidant overload. And so they're not able to break down old and injured cells. So the new ones can make new stuff. They can't get a new skeleton every 8 to 10 years because their teeter-totter's out of balance, like with too many antioxidants. So there needs to be this balance, and, starting, giving a peroxide, giving an ozone, giving, high dose vitamin C in a sick patient starts this movement of this teeter-totter and these electrons moving, and it gives the body some energy and some movement to fight, and it supports the immune system up. So I think that's how the whole thing works. And I can tell you that when it's done appropriately, there's very little side effects to this. Now, does every patient improve? No, I don't know what the miracle is for every single person out there, but I can tell you the vast majority do. And when I study biochemistry and look at physiology, it certainly makes sense to me that this therapy should work, and it does work, in clinical practice. And as you said, I've been doing this for 30 years. Clearly, if this wasn't working, I wouldn't be doing what's not working. I'm sure patients would not be coming back if it wasn't working.
Yeah, fantastic.
But it's remarkable therapies when it's used appropriately.
I want to talk about this antioxidant and sort of oxidant therapies, because how do we measure this? And I've spoken to a lot of doctors, 83 shows now. I've had 23 years of clinical practice in my other life. I know all my data. And looking at my own data, if I look at sort of oxidative stress in my body, looking at liver enzymes, looking at GGT, looking at oxidized LDL, looking at T3 to reverse T3 ratio being very important. I'm definitely, if I look at it, I'm sort of more on the oxidative side. That could be because I'm a marathon runner. I've run many marathons, ultra marathons, over 35,000 kilometers in the last 25 years. I'm doing intermittent fasting, which is a hormetic stress. So there's a lot of hormesis there. I'm doing infrared sauna 6 days a week. I'm doing cold thermogenesis, 6 days a week. There's a lot of hormetic stress. There's a lot of probably oxidative stress there. I'm doing some drips every week. How do we measure, this? Obviously, when I did my bloods, my labs, and looking at organic acid tests, I need more antioxidants. I'm not taking enough antioxidants. But give us your process or your thinking, because I think this is fundamentally important. There's some people that are taking too many antioxidants. Listening a lot to Joseph McCullough about him decreasing the number of antioxidants that he's taking because people have taken too many antioxidants. What are your thoughts about hormetic stress, oxidative stress, and antioxidants?
Well, I sort of, my thoughts are to balance that teeter-totter. So if you're running, a huge amount every week and saunaing every day, then you are going to need some antioxidant support, and the human body is a pretty resilient thing. I mean, look at what we deal with. I mean, we deal with, in our country, I don't know if it's as bad in your country, eating crappy food, all the pollution, all the pesticides, all the insecticides, all the bad hormones that are out in the environment. And people here, 2/3 of Americans are overweight and over a third are fat, obese. And we got a mess on our hands. So we have our own oxidative stress and hormonal imbalances and things like that. But I think that when a patient is in front of me, I am constantly thinking, of this teeter-totter phenomenon, how to get it going. The biggest complaint, what are the biggest complaints patients tell you? They're fatigued. I mean, they're all fatigued. You can't be seeing any different patients than I'm seeing. And, it's the number one complaint. They're fatigued. And then next is, my brain's not working or something like that, or I'm achy. And, it's what's happening today. And I think it's just, these are symptoms of our biochemistry being imbalanced, our physiology being imbalanced, and our teeter-totters being imbalanced. And so the blood work is very helpful. And I use a lot of blood work. My patients know, I check a lot of their vitamin levels, a lot of their hormonal levels, a lot of their mineral levels. And, I always describe to the patients, it's like a big pie. Your situation is a big pie. And I don't know if we're dealing with half of that pie by, what stuff we're talking about today, or a quarter of the pie, or 3/4 of the pie. But if you can deal with enough pieces of the pie, the human body is so well designed that it can restore energy production. It can restore good function and good biochemistry, even though you haven't dealt quite with everything with it. So in someone like you, who's incredibly active and incredible, yeah, you're going to need antioxidant support. But look, I can tell you, even for someone like you, when you get sick, you'll benefit. I'm sure I'm taking a guess that you have benefit from nebulizing peroxide when you become ill with something. And I can also take a guess that you would benefit from an ozone, however you're getting it in your body, ozone, inside your body when you're sick. And these therapies work. And, we produce superoxide dismutase. There's a whole bunch of oxidative therapies that we produce. And there's a reason we produce it. We probably produce our own ozone, although that's not 100% clear. But I'll bet we do produce our own ozone. And, vitamin C has dual properties, depending on how much you're giving versus oxidant and antioxidant therapies. That's why I think vitamin C is such an important therapy for people to take orally as well as intravenously. And iodine's another one that has both oxidant and antioxidant properties to it. That's why in my practice, look, if the federal government came to me and said, you know what, you can't do any more of your therapies, we just want you to use drugs, but we'll give you one. What do you want to continue with? The first thing I would tell them is iodine. Wow. And if they say, we'll give you one IV, you got to get rid of your 50 other ones. Which one are you going to keep? Peroxide would be the one I would keep. Now, those are both, iodine can be considered both an oxidant and antioxidant because it can gain and receive electrons depending on which form of iodine we're talking about. But peroxide's an oxidative therapy. That's the one I would keep over all the other IVs, just from the reports from my patients.
Fantastic. Let's go into thyroid dysfunction and looking at T4, T3, Hashimoto's thyroiditis. reverse T3. There seems to be an absolute, talk about an epidemic of conditions. I think in 1979, 1% of thyroid dysfunction was Hashimoto's thyroiditis. And now I think it's over 90%. It's become an absolute epidemic. It's very, very important to health. Obviously, iodine, I'm not sure if you use Lugol's, at what concentration you use. Give us your protocol on maybe assessing thyroid function. Obviously, it's part of functional medicine, but I just think it's important if we give, the audience a little bit of content and value with regards to how to manage their thyroid with the modalities you use.
So I started off 30 years ago with treating my father, who was sick with heart disease, and I treated him. I wasn't interested in any of this stuff. I didn't go to med school for this. I went to med school to be a family doctor and to model myself after my family doctor. And in my household, we didn't take vitamins, we didn't take minerals, I ate fast food. I didn't eat it all the time, but we had soda every once in a while. Whatever. I didn't pay attention to what I ate. And of course, what I didn't realize was this severe asthma, an allergy thing that I was suffering with all these medications and inhalers and allergy shots, were being driven by a lot of what I was eating. But I went to med school just to be a regular doctor, and I didn't know anything about vitamins or minerals, and I started practicing medicine. And so my father was really ill with heart disease at that time. He had his first heart attack at 40, his second heart attack at 42. And 20 years later, he looked like he was going to die at any moment. I just finished my medical training and ready to go out and practice medicine. And he was on 12 different medications for blood pressure and high cholesterol and diabetes. And he looked awful. I mean, he was pale and pasty and was having continual angina for 20 years, using nitroglycerin pills like they were candy. And he couldn't do anything. He would do anything, he'd get chest pain and take a nitro. And he had a couple of bypass surgeries and a couple of angioplasties in the intervening years, but we were all getting ready for the phone call that he had died. And he looked terrible. I mean, as a physician, you get to get some experience. You can look in someone's face and say, "Hey, we got a serious problem here." Or, "Hey, you look okay. Let's try and figure this out. We can do this at home." But you would look at my dad's face and you're like, "That's a serious problem. He did not look healthy." So I'm 6 months into practicing conventional medicine, and the short version of the story is I get handed a book, Healing with Nutrition by Jonathan Wright, who's an allopathic physician, by a patient. And I open the chapter to heart disease and I read his chapter. I read it till late at night because this was written by an MD and he cited it. And he's writing that heart disease isn't a cholesterol lowering medication deficiency problem. It's a lifestyle problem, and it's a nutritional problem, and it's a hormonal problem. So from what I read in that chapter, I remember until 2 a.m. Wow. I worked the next day. And that was my first exposure to any of this. And I called my dad in the office. I called my dad in the morning and said, "I want you to come in and get some blood tests." So I drew 2 blood tests on him. I drew his thyroid levels and I drew his testosterone level. His testosterone level read as below detectable limits, so near 0 on the lab test. His thyroid levels were in the reference range, but way on the lower side of the reference range. So I put him on 2 things at that point. I put him on natural thyroid hormone, desiccated thyroid hormone, and I put him on natural testosterone topically. And within 7 days of starting those 2 things together, his 20-year history of angina went away. He never took another nitro pill. 30 days later, before I get to 30 days later, so he calls me up 7 days later and says, "I didn't need nitro today." I'm like, "Wow, that's good." And then calls me the next day. I'm still not taking nitros. And, I see him on the weekend a few days later, and he looks like, instead of pale and pasty, and like that, one doctor looking to him saying, "Hey, you're sick and this is not looking good." I'm like, boy, he looks like healthy, somewhat healthy, again, or healthier. And 30 days later, I check his cholesterol levels. He never changed any of his bad habits. And my dad could eat like the best of them and smoke. He smoked, he was overweight, never exercised a day in his life, and could eat food like no other. And his cholesterol in the 300s, mid 300s, falls below 200 without medication, and not changing his bad habits, and was just getting his hormonal system somewhat rebalanced. I ended up treating my dad with other hormones, some adrenal hormones, DHA, pregnenolone, and progesterone. But really, the way I got started in this was thyroid hormone and testosterone. So every patient from that moment on gets a full thyroid workup and a full hormonal workup. So that's the prelude to thyroid. The thyroid gland sits in the lower part of the neck. It weighs about 1.5 ounces. It produces a teaspoon of thyroid hormone for a whole year. That teaspoon of thyroid hormone is supposed to drive the metabolic rate of every cell in the body 24/7 for 356 days of the year. And if we have little variations in that teaspoon, we get big problems in our body, since every cell needs and requires thyroid hormone every single day. So I start checking people for thyroid problems, and I was taught in med school, just check a TSH level back then. If the TSH was normal, that's the thyroid stimulating hormone. It comes from the brain, and it goes to the thyroid and tells the thyroid produce more or less thyroid hormone. So you check a TSH level. If that level is in the reference range, they're fine. Whatever they're dealing with is not a thyroid problem. That's how I was taught. I was never taught to check the inactive and active thyroid metabolites, T4 and T3, being produced from the thyroid gland and getting released into the bloodstream. And I certainly was never taught about what reverse T3 was, or I wasn't even aware of that term. Back then, I had to learn it myself. So I see the changes in my dad, and I started learning everything I can about thyroid, everything. I'm reading everyone's book. I'm reading every article. I am going back to basic biochemistry and physiology, and I start studying my patients, and I find 2/3 of them have thyroid problems. This was early 1990s. And so I probably have, I would estimate 70% of my practice on thyroid hormone a couple years later in the mid to late 1990s. And my patients they're reporting that they're feeling better. Their cholesterol numbers are better, because with low thyroid, your cholesterol number goes up. They got more energy, and their brain is better, and my practice is growing, and I didn't see any side effects from doing this. And then I learned about iodine a couple years later. And when I saw all these people with thyroid problems and improving with thyroid hormone, it was bothersome to me. Why would 2/3 of my practice need thyroid hormone just because they're getting older to feel good? I mean, that doesn't make sense. We're not designed to all of a sudden become lacking thyroid hormone. I mean, how would we survive as a species if that was the case, So I started researching, well, what does the thyroid gland need to make thyroid hormone? What is the basic constituents that it needs? And it needs magnesium, it needs selenium, it needs iodine, it needs some vitamin C in there. So I started looking at all that stuff. And when I learned new things, I would check patients' levels of that and perhaps try them if they were low. And, nothing seemed to work as well as desiccated natural thyroid hormone. I mean, nothing supplanted that, doing that therapy. Then I learned about iodine. Now, iodine, the highest concentration of iodine in the body is in the thyroid gland. We don't make our own iodine. We have to get it either food or we supplement with it. So it's an essential element that every cell in the body needs and requires. So I was well aware of where I live in the world, in the Great Lakes area of the United States, in Michigan. And our soil is one of the most iodine deficient areas of the world. The world can thank the Great Lakes area and iodine deficiency in the soil for iodized salts, because it really was reported and promoted from where I live in the early 20th century. And what happened was there was a lot of goiters in the early 20th century in my area of the world and the states surrounding me. And the US government did a study and found that there was low iodine. And when they put iodine in the form of iodized salt, the swelling of the thyroid epidemic went away. And they instituted iodized salt for the rest of the country, and really the world kind of took off with it from that point on. So I knew we were in an iodine deficient area, but in the 1990s, there was no testing for iodine. I didn't know how to. The only thing I learned about iodine in med school was iodine deficiency is a thing of the past. It was rectified by iodized salt, and move on. There's no iodine deficiency anywhere in the United States anymore. Well, I meet the guru of iodine, which is Dr. Guy Abraham, and he writes a little letter to the editor of one of the journals that I get at the time around 1997, and he writes how he developed an iodine loading test. Well, I read the article, I call him because there was no good testing for iodine, there was no good reference ranges. And him and I start talking, and he becomes interested in my practice immediately because of where I'm from. He knew we had a low iodine in the soil. He said, your patients have to be iodine deficient. They're not going to get it from their food. And people are using less and less salt. And you're seeing all these thyroid problems. Could be low iodine. So we start testing people. We test a few hundred of my patients. We wrote these articles up, and 97, over 97% were low in iodine. And so we instituted, I started putting people on iodine, milligram doses of iodine. And all of a sudden I'm finding I can lower the thyroid dose down. A few years later, about a decade later, I do a little survey for a couple of weeks of my patients. And what I find was, instead of having 2/3 of my patient on thyroid hormone, now I have a third of patients on thyroid hormone. And instead of 120 or 2 grains being sort of the average dose back then that I had them on, 30 milligrams is now the average dose I have them on. So I was able to decrease, twofold the amount of patients taking thyroid hormone and decrease their dose almost threefold, fourfold compared to what they were on, just by correcting the underlying problem of their thyroid, which is iodine. And the reason we're seeing such a rash of Hashimoto's and autoimmune thyroid illness is iodine deficiency. I read about that in my iodine book, iodine, why you need it, why you can't live without it, that it's iodine deficiency causing this rash of autoimmune thyroid disorders. But it's not only causing autoimmune thyroid disorders, it's causing problems in all the glandular tissue. The iodine concentrates in the glandular tissue. And the body has specific mechanisms to take iodine from a higher concentration in the bloodstream and put it into the glands at a low concentration. It needs energy to do this, to go from a high to a low area. And so we have a specific energy dependent mechanism to do this. And the reason we do this is because we can't live without it. And so the glandular tissue includes the thyroid, the ovaries, the uterus, the breast, the prostate, the testes, and the pancreas. And iodine's main job in those tissues is to maintain a normal architecture. And if I call this the normal architecture, and iodine deficiency, you start to get cysts in those tissues. If it goes on longer, the cysts become hard and nodular. If it goes on longer, they take a hyperplastic appearance if you look at biopsy under a microscope. And if it goes on longer, they become cancerous. And this has been shown in animal, test tube, and human studies. And iodine has also been shown in these same studies to halt this progression and reverse it. And so the reason I think we're seeing this epidemic of breast cancer, I'm sure you guys are seeing the epidemic of breast cancer, right? In the US, it's 1 in 7 women, and we have 1 in 3 men in prostate cancer. We have epidemics of ovarian, uterine, pancreatic cancer. Pancreatic cancer skyrocketed since I started medicine. And thyroid cancer is the fastest growing cancer in the United States. I would imagine it's probably the same with you guys. And I say this is all, the common denominator behind all of this is iodine deficiency. And it's still occurring, and it's being exacerbated by our increasing exposure to pollutants like bromide and fluoride. And we've got a mess on our hands, and we're in our country, we spend 20% of our GNP on healthcare, and we are last or next to last in every single health indicator when compared to every Western country out there.
Wow, sure. That was an incredible summary in terms of how important thyroid health is, and looking at iodine. And do you do a push? I mean, the person who's listening out there, how much iodine should they take? I mean, it's not something, that's commonly known, I think, here in South Africa. I mean, I think obviously Lugol's a solution that I've used. Do they do a push load test? If someone's listening, what's the dosage they should be taking if they can't get a test? What's your overall view?
I mean, look, it's best to work with an iodine knowledgeable, literate physician. So it's best not to do this on your own. And that's what I would recommend everybody doing. Having said that, do I think everyone needs an iodine test? I mean, look, I can tell you what's happening in my area because I've been testing people for, I got thousands of tests. And so I do like testing people, and I do like review, having data at hand to, make decisions. So most of my patients are on 25 milligrams of a combination of iodine and iodide. If they're healthy, if they have a glandular problem, such as a problem with the thyroid, ovaries, uterus, breast, prostate, pancreas, or testicle, they're usually on a little bit more. If they have cancer of those tissues, they're on more. So I would say 25 to 50 milligrams is the average dose, say, of most adults on. Kids, a little bit lower dose. Lugol solution is fine. 5% Lugol solution, 1 drop of it provides 6.25 milligrams of a combination of iodine and iodide, the oxidized and reduced form of iodine and iodide, respectively. And so most patients would take like 2 drops. Some will take 4 drops, 2 to 4 drops is most patients. And then if they have any of those glandular problems, they'll take more. 8 drops is 50 milligrams.
Okay, fantastic. And I think that's incredible. I want to move on to how important things like IV drips, like NAD. I haven't been really, we run a bit of an IV clinic here. I haven't found it that beneficial. There's a lot of sort of nuances when it comes to the latest IVs and, how many grams of IV vitamin C. And I think obviously you've got a lot of experience in IVs, been doing it for many, many years. What are the things to be aware of that aren't as good as what the public or the latest anti-aging or functional medicine doctors are saying that, empirically you've seen haven't been that beneficial? What are your thoughts there?
Did you say NAD has not been that effective?
Yeah, NAD is not been that effective for a lot of people.
I haven't used NAD, and the reason I haven't used NAD is A, there's a lot of side effects with it from what I've read. B, it was expensive and it takes a long time to put it into somebody. And C, I thought you could get the same benefits from doing like a simple Myers IV, which is a sort of overall inexpensive way to get B vitamins, minerals, and vitamin C in the body. And so I haven't done anything. That was very interesting for me. I thought that's what you said.
Yeah,
and
exactly.
So before doing IV therapy on people, it's so much more important to do the basics. Eat good. Keep sugar out of the diet. Keep refined foods out, particularly refined carbohydrates out of the diet. Look, we got a new doctor in our office, Dr. Cindy Lepak, and she was an emergency room physician who has her own story of how she got involved in holistic medicine, her own personal story. And she became, a patient at our practice because of a serious health problem and got better. And she started hanging around and she wanted to hang with me and watch, and she says to me, I want to do what you're doing. And so for 2 years, she came every week, shadowed me. I give her books to read. We talk about it. We went through articles together, and, she joined our practice. And so one of the things she was overwhelmed, at the beginning, when she was shadowing me, like, oh my God, how am I going to do this? I'm like, Cindy, I've been doing this for 30 years. You'll learn it. It'll come. But really, don't get caught up in the weeds here. Do the basics. And the first basic is, before talking about IVs, is just eat a healthy diet. And the quick and dirty of it is, if people could just cut out sugar, any refined sugar in their diet, cut out refined carbohydrates in their diet, they can eat whatever, and eat organic food. Eat organic fruits, vegetables. If you're gonna eat animal products, eat organic animal products, not fed, so they're not fed crappy food. And do a little, and so that's the basics to me, is eat decent foods. Number 2 is drink enough water. Body's 70% water, the brain's 80% water. Take your body weight in pounds, divide by 2, and that many ounces of water a day should be the minimum. If you're an athlete like you are, and sunning and sweating and running, you'll need more water. Number 3, maintain adequate salt levels, because we do not do, look, if you take all the minerals in the body and you burn the body up and you measure, dry weight of these minerals, sodium and chloride are huge. We should have over a gram of sodium, a gram of chloride at any one time in the body. We need to maintain that. So take enough salt. Exercise is part of the basic stuff. Daily exercise. You don't have to go marathon running like you are. Just walking is fine. Bouncing on a trampoline, whatever suits you. Go to a gym, don't go to a gym, but just movement. And then, the last part of the basic thing I would say for people, there's 2 of them. These are the 5 basic things: is iodine, maintaining adequate iodine levels, and vitamin C, since we don't produce our own vitamin C. I would say, let's do that before we get into IVs. But, if we want to get to IVs, a basic IV is a Myers IV. named after Dr. John Myers from Baltimore, Maryland. He developed this concoction of B vitamins, vitamin C, magnesium, calcium, vitamin C. I mix it up myself on the weekends when my nurses aren't there. I think I got it all. And, you push it in over a couple of minutes, and this Myers IV creates this gradient where you get this huge rise in things in the body, and it diffuses into the cells where it's lower. It's not a terribly expensive IV. It's not a long IV. And, that's a basic IV. I consider peroxide a basic IV when you're sick. I consider ozone a basic IV, or if you're doing it rectally at home, or if you're doing ear ozone, if you've got, sinus stuff, or, sore throat and stuff like that. It's interesting when you get into these NAD like IVs, like you're talking about. I'd have to see really good data that, why bother with it? It's expensive. It takes time. Get these hypoglycemic episodes and, these problems with it. And you go too fast, there's a problem, vitamin C is a basic thing. You can do it orally, you can do it IV. And, my partners and I always say, just do the basics. I mean, that helps out the vast majority of people before you start getting into, weird stuff and, fancy, expensive stuff.
Yeah, great. And look, last question as we close the show, I'm very grateful for your time, is something that we ask all the guests, is that over many, many years, I've seen patients that come in very sick, they get better, they feel better, they put the things in place, they change the lifestyle, they change the habits, and then a year later, they're back to their old ways. They can't maintain it. They battle to maintain their sustained transformation. It's probably one of the toughest areas I feel, is that people are reactive instead of, maintaining their health. We've adopted health coaches, which have been really, really good between the physician and the patient to help people with the community. But give us a bit of wisdom after so many years of practice, how you, encourage or inspire or motivate people to maintain these healthy habits, because it is the narrow road and it is difficult for patients to maintain.
It's really hard in our world, in our fast world. And, look, fast food, do you guys use the term fast food?
Yeah.
Fast food is cheap. You go to McDonald's, you go one of those places, it's inexpensive food and it fills you up. And actually, look, I remember my younger days, I loved McDonald's, and those McDonald's French fries, every once in a while, I still have a taste for them. And I haven't had one, I don't know how many, I don't know, 25, 30. I don't know what I've had, when I've had one last. But I was just telling my wife the other day, I'd like to taste a McDonald's French fry again. But anyways, my view is, my relationship with my patients is, they're driving the car, I'm on the sidelines, I'm on the side of the street yelling, hey, go right, go left. And if I see them heading for a tree, I'm starting to yell louder, turn right, turn right, turn right. And if they hit the tree, I'm the first one there to open the car door and try and get them out of there and get them into another car. And then we start running again. So my feeling is, what? Here's what I think you should do, or here's what I think, health is, and, how to be healthier. And if you hit the tree or you fall off the path, you know what? You're still here. Let's get up and do it again. And, I think that our society is very harsh towards everything right now. And we need to be less harsh. We need to be more supportive, and we need to just work with people with where they need to be. Look, not everybody can go run marathons and go in the sauna 6 days a week and, trampoline at night and do everything that's the best thing for them. And, to tell you the truth, most people don't have to do that to feel good. They can feel good doing other things. But I can tell you, most people won't feel good smoking and eating fast food and not exercising and being dehydrated, and they won't feel good. And so it takes some cajoling and takes some, yelling and, maybe a little louder yelling at times. But, I want to be their biggest supporter, and I want to be on their side. And, I'm not looking down at anybody. And trust me, I get frustrated. I'm sure. Are you still seeing patients?
Yeah.
I get frustrated and I get irritated, especially when I see stuff happen to them that I know shouldn't have happened to them. And, but, I do that in private, with my partners, we complain a little bit, when stuff happens. But, one of the most frustrating things for me is to see people go on dialysis that don't have to do it. And they go on dialysis because they eat a crappy diet and they don't drink enough water. one or two of those things will put you on dialysis in old age. Especially, you can go on dialysis just from not being chronically dehydrated. And it's the most frustrating thing for me. I tell them, hey, you just got to drink more water. Look, your kidney function is getting worse. Look here, and I show them the chart, turn it around to them and say, hey, it's going in this direction. We need to bring it to this direction. And so, what do? You just keep at it. And when my feeling is that one of the reasons I started writing books was I was having to give too many explanations to people about why you need balanced thyroid, why you need iodine, why you need to eat better. I've got books on all the diet and thyroid and iodine and ozone and viruses and things like that. So I wrote the books and I would say, hey, here's what I want you to read. Here's my thoughts on it. And then let's work together on this one. And so I feel like if we can educate patients, an educated patient does way better than an uneducated patient. And when they get knowledgeable about antioxidants and oxidants, when they get knowledgeable about statin drugs or medications or vaccines, they can make an educated decision whether they think that particular medical therapy, the benefits outweigh the risks. Because I was taught in med school, you're supposed to give them informed consent with any therapy you're prescribing. Any therapy, they need informed consent. Well, that seems to have been thrown out the window lately in the United States, but it's still, for me, it's still there, and it's still, I practice the same way that I was taught. And my patients are getting informed consent, and they can make their own decisions. Look, if I tell my patient, I don't think you should take that drug, or I don't really say it that way. What I say is, here's the positives and negatives. And if they ask me, would you take that drug? I'll tell them what I would do if it was me. But if I say I wouldn't take that drug and they decide to take it, hey, I'm on their side. I say, let's move on. Let's work around that, and let's follow it. Make sure that you're going to do okay with it.
Fantastic.
And that's how I approach them.
Dr. Brownstein, thank you so much. I salute you. I declare favor and blessing over you. Thank you for your courage. Thank you for your calling. Thank you for your dedication to write these books. Your inspiration. You don't know me. We've just met now. You've changed my life. I'm doing hydrogen peroxide nebulization at least 4 times a week. Why? It helps me with allergies. It helps me with my sinus. It helps me sleep better. My nasal breathing, which is so important. We teach a lot of nasal breathing exercises because that's become a real problem. People mouth breathing. So I just find when I use it, it just helps me breathe better. It helps my 5-year-old. It helps my wife. It helps my son. I'm friends, family. It's so simple. It's so effective. It's so affordable. So thank you so much. And I look forward to connecting hopefully next year, looking at the protocol, the COVID protocol that you've developed, maybe getting into the weeds a bit more on that. But I wanted to give people an overall view today, especially on topics like the iodine and things like thyroid, because I think you're a sort of a well-oiled machine there. You've seen the data, you've seen the research, you've had empirical evidence, and I think it's always a combination of both. So a deep gratitude for your service, for who you are. It's you're touching many people's lives that you don't even know about.
Oh, I thank you so much. And it was nice to meet you. And I'd like to talk to you more about what you're doing in life. And, let's just keep at it, man. Just look at biochemistry and look at physiology. Just try and support it. Why use things that break it down? We need to use things that support it. And everything we've talked about today supports that stuff. And that's what we should be doing as physicians.
Fantastic.